Good morning, everyone. We're going to get started with our webinar. The Mountain Plains Prevention Technology Transfer Center at the University of Utah is excited to welcome you to our 6-part webinar series, Informing Prevention with an Emphasis on Adolescents. A recording of this webinar will be posted on our website at pttcnetwork.org/Mountain Plains. Slides will be available in PDF format and posted on our website as well. For those of you interested in a certificate following today's webinar, please email mountainplains_pttc@utah.edu. NAIADAC approval is pending. For all other licensure and credentials, please apply directly to your board. All participants have been muted today. We encourage you to use the chat feature for your questions and messages. Following the webinar, you will see a link in the chat feature along with the QR code to complete a survey. The survey is required for all training events funded by Substance Abuse and Mental Health Services Administration. They want to know how well we provide our services, and we want your feedback to help us improve our trainings. The information you provide is confidential. We ask that you please take a few minutes to complete the GIPR evaluation form. It is my pleasure to introduce our presenter today. Dr. Jason Burrow-Sanchez is a professor of counseling psychology in the Department of Educational Psychology at the University of Utah. He is also the director of the Mountain Plains Region 8 Prevention Technology Transfer Center, funded by the Substance Abuse and Mental Health Services Administration at the University of Utah. His research interests include the prevention and treatment of substance use for adolescents in school and community settings. His research has been funded at the local, state, and national levels and has published numerous articles, chapters, and books. He is also a licensed psychologist in the state of Utah. It is my pleasure to turn the time over to Dr. Jason Burrow-Sanchez.
Hi, everybody. Thank you, Shannon. It's a pleasure to be with you today, and thank you for taking some time out of your day to be with me for the next hour or so. So we are going to talk about epidemiological data, but I focused the webinar around some key questions that we're going to talk about within the course of the next 50, 60 minutes or so. So one of the first questions is, how can we determine the scope of a problem for our target population, and specifically looking at data? The second question is, where can we access the data? And then the third question is, in what ways can we analyze, or more specifically, display the data? So we're going to talk about each of these as we go along. The other thing I want to let you know is I have a bit of a self-disclosure to make. This is a webinar I wanted to do for quite a while, in part because I get asked a lot about data analysis and how do I access data, where do I get it, and so forth. So this is really fun for me because I get to, the next hour or so, share some of those ideas with you about how to do that. Okay, so let's kind of get started. But before we get into it specifically, I also wanted to point out some of the prevention frameworks that we work from. And I do this in part because we're a prevention technology transfer center, and also to bring some of these principles together. But some of you may be familiar with SAMHSA's strategic prevention framework. And if we're using epidemiological data or data, we may be working at this planning stage, where we may be trying to figure out, okay, what is the prevalence of something in a particular population? So how many youth use alcohol in a particular state or in the nation, and so forth? Or we may be working at the evaluation stage here. What does the outcome look like for a specific intervention that we've implemented, and so on? So there's a couple particular places, and again, these aren't mutually exclusive. You can use data in all these different areas, but specifically planning and evaluation are 2 points where you're going to use data. Another framework that you may be familiar with in terms of the prevention and treatment literature is the Institute of Medicine framework, in particular related to prevention, the universal, selective, or indicated areas of prevention. And again, if you're using epidemiological data, you may be using data at the universal level, selective level, or indicated level. And what I want to point out here is that your questions for what you ask of your data may change depending on what levels you're looking at. And one model that I like that's kind of taken out of the IOM model is this prevention triangle. This is used a lot more in the school-based literature and so forth, but this again is the primary prevention, secondary prevention, and tertiary prevention. So if we consider this triangle, let's just say a school, the question that we ask at the primary level may be something like, well, how prevalent is alcohol use for everybody in the school? Right, which may be a prevalence question, as opposed to if we're delivering a specific intervention at the secondary or tertiary levels, what are the outcomes of that intervention? What does that look like? So those questions are slightly different, and how we approach those things are slightly different. And that's just what I'm trying to illustrate with these few slides here. And now I want to jump into a few quick definitions before we kind of get into the specifics of the webinar. And because I have epidemiology in the title, I wanted to kind of give some explanation of what that means in the context of this webinar. So I know there's probably many definitions of epidemiology out there and so forth, and derivatives of it, but in the context of this webinar, we're gonna explain it in this way. It's the examination of health issues in a population. Okay, so you have to determine what that population is. Is the population a specific school? Is it a specific state? Is it the nation? Whatever that means for you, you have to make some determinations of what that looks like. And from epidemiological data, we usually ask questions around prevalence. For example, what does the occurrence of something look like in a population? So what does the occurrence of alcohol use look like within a youth population and so forth? Or we may ask questions in terms of what are the causes or what are the etiology of a particular issue? What are the causes of adolescent substance use? What are the causes of other mental health concerns and so forth? And another way we may look at these types of data is also ask ourselves, what are the outcomes in terms of if we have interventions or if we integrate an intervention or implement an intervention, what are specific outcomes that we can tell from our data and what do those look like? So the reason I point those out is because in terms of what you want to get out of your data, you really have to be clear on what you're asking of your data in terms of your question. We're going to talk about that a bit more in a sec. The other thing I wanted to point out is that even though the epidemiology literature generally refers to a population or trying to get at something with a population, the reality is most of the time our data is from a sample. Okay, so our data is from a sample of people or a sample of states or a sample of the nation, whatever, or whatever it may be. And what we do is we infer to the larger population. So the data sets that I'll show you a little later on are, many of them are inferences about the larger population. The larger population may be the population in our nation, so in the US. But really what we do is we collect samples and then make inferences about those samples to the larger population. How do we do that? We do that different ways. It's based on the methodology in terms of getting a representative sample of folks within our sample. Also, it's using statistical techniques to weight our samples so that we can make specific inferences based on the characteristics of what we know of the larger population and so forth. Okay, but what I'm just trying to show here is that most of the time we're dealing with samples, even though we may be trying to infer to a larger population. Okay, so let's start with the first question. The first key question is, first of all, how do we determine the scope of a problem? So my guess is many times you've probably been in situations where you wanted to know something, right? So for us, I've posed a couple questions here, and they're a little bit different, and I'll explain them to you as we go along. But the first question I posed is, how many youth are using alcohol? And you may, and you can substitute in any substance you want here. It doesn't have to be alcohol. It could be marijuana. Excuse me. It could be e-cigarettes. Could be, combustible cigarettes. Whatever it may be. But for this illustration, we're going to answer the question, how many youth are using alcohol? Well, if you're asking a question specifically of data, you want to be more targeted than just the general question. And so what the other things I included here is the things that we want to consider within our question is, who are the youth we're asking about? Okay, what are their ages? What do they look like? Where are the youth? Are they in a specific area, specific state? Are they in the nation? What does that look like? What's the quantity of alcohol do we want to ask about? Do we want to ask about single drinks? Do we want to ask about binge drinking? Do we want to ask about heavy drinking? And the reason I bring up those is because those have different definitions in the literature and also in the epidemiological data. Okay, and what's the time range of alcohol use? Is it in the past year? Is it lifetime use? Is it over the past 30 days? So all these things you have to make some distinction about in terms of what they look like and how you want to answer your question. So the other thing that I want to say is that this type of question is a prevalence question. And remember what I talked about before, it's prevalence because we're asking, what does this look like within a specific population, okay? As opposed to this type of question, what are the percentages of youth completing substance use treatment? And again, we still want to get subcomponents of this in terms of who are the youth and where are the youth and what's the type of treatment. But this is more of an outcome question. and we're asking, what does this look, what does the outcome look like? What is the percentages of youth completing treatment, completing substance use treatment? What does that outcome look like? So they're slightly different questions. Throughout the course of this webinar today, we're actually going to go through both questions, but let's start with this first question around alcohol use first. Okay, so if we break this question down a bit more, how many youth are using alcohol? We have to make some distinctions here about who are our youth. And I just put some characteristics up here, some things that I thought about, some common things that I come across. You know, who are the youth? What are the ages? Well, you know, I ended up picking ages 12 to 17 in part because the data sets that I worked with, I know I have access to those ages, and so I can help answer that question. It does help if you have some idea what the data sets look like. So, because if you're taking existing data sets, you will be limited, of course, by the characteristics of the data that's there. Who are the youth? Do I want to go for school-based data or community-based data? Well, what are some of the differences in those data? If I go for school-based data, that may be more relevant to what I want to look at. Maybe I work in a school setting. If I go to community-based data, that may be more relevant. But also consider that in school-based data, especially as you increase in grades, right? Grades 8, 10, 12, they don't account for school dropout. So you may have students in your sample at grade 8 that you don't have in your sample at grade 12. And so sometimes that's why community-based data may actually answer your question better. So again, it's your decision in terms of what types of data you want to use, but just think about some of the limitations of the data sets that you're accessing. So for me, to answer this question, I'm going to go with community-based data. What about the quantity of alcohol? Do I want to look at per drink? Do I want to look at heavy drinking? Or what does that even mean? Or do I want to look at binge drinking? And what does that even mean? Well, these things tend to have specific definitions in the surveys that you look at, and they may be different across surveys, and they may talk about them a little differently. But you need to be clear based on the surveys and based on the data sets that you look at what these definitions look like. So I'm just going to make it kind of simple here. So I'm just going to say per drink. And then the other thing I would ask you to consider is what's the timeline of alcohol? Is it lifetime alcohol use? Is it past year alcohol use? Is it 30-day alcohol use, right? And all those things have slightly different characteristics, and they will give you different types of data in terms of what you determine. So for us, again, I'm going to be pretty straightforward here and choose just 30-day alcohol use, okay? So I broke down my question, how many youth are using alcohol, to more specifically to specific age group. I'm going to look at community-based data. I'm going to look at per drink, and I'm going to look at the past 30 days. Okay, so let's make this even more clear. And one of the ways we're going to make this more clear is, remember I talked about there's 3 key questions at the beginning. Well, one of the ways that I'm going to make those 3 key questions even clearer is have a 3-step data plan. So this is Jason's 3-step data plan for how to ask your question, how to gather the data, and then what to do with it. Okay, so the first part of that 3-step data plan is, what is my question, which we've already gone over in the first few slides. And my question, as I said in the slide before, is even more specific. So what is the prevalence? I'm asking a prevalence question of adolescent alcohol use for ages 12 through 17 and the past 30 days within region 8, and I'm even making this a little more specific, in region 8 of the US. And why am I asking about region 8? Well, our Prevention Technology Transfer Center is housed within region 8 of the US. And what does region 8 mean? For us, that's 6 states. It's Utah, Colorado, North and South Dakota, Wyoming, and Montana. So I'm going to limit myself to that for this specific example. But I hope you see what I did here. And again, you can broaden this or limit this or make different changes to it. But the idea is that I want to be really clear on what my question is, because that's going to help me to answer it and also access the data that I want to access. So I got my first step down. My second step is, now where do I get the data? Where does that even come from? Well, it turns out that there's a lot of data available, and a lot of it's publicly available that you can access, and I'll show you how to do that in a sec. It's either state level data or national data, but it also turns out that you may work in a setting like a school setting or a community treatment setting, that you may have existing data that you can access from your site that is more specific and more localized to your site. And also, if you're so inclined, you could also create your own survey if you want. But however, if you do this, and I've done each of these types of data analysis and data gathering exercises, but I will tell you that if you do end up creating your own survey, look at some of the publicly, before you do that, look at some of the publicly available data sources, because many times the surveys that have already been created with your tax dollars actually are available for you. So you don't necessarily have to recreate the wheel with your own survey. You can actually borrow from surveys that have already been created. Well, it turns out that this step, even if I have a great question and I know what I want to ask, this step is sometimes where people get stuck because they're not sure where to access the data. And that can be frustrating, and I realize that, myself included. But being a researcher, in part, is what I also like to do is go out and access where are the answers to these questions and how do I get them. So one of the things I did for you is I made kind of a cheat sheet. So here's the question, where can you access the data, or step number 2. And this is just a table that I created. And these are from data sets that I've used before. Some of them I've used before, some of them I haven't used before. Some of them I've used more intimately than others, meaning I've actually pulled down data off the sites and manipulated the analysis, done the analysis, and then come up with answers and so forth. Some of these data I've just used papers that I've written, I've cited the data sources and so on and so forth. So it just depends. But it depends on what the questions are that you want to ask and you want to get answered. Now, I do want to point out here, here's the names of the surveys, okay, in this column. Here's the acronyms that will come up for those surveys and what they're commonly referred to in the shorthand. Here's the major sponsors. So for example, Substance Abuse and Mental Health Services Administration, and so on and so forth. I won't go through all these. Here's the data type in terms of, are they household surveys? Are they school surveys? Are they treatment-based surveys and so forth? Here's the frequency in terms of how often they occur, either on an annual basis or every odd year, every so many years. Here's the scope. Are they national? Are they state-based? I did include one state-based, and we'll talk about that in a sec. But also realize some of these national data sets also let you drill down to state level as well. Some of them do, some of them don't. Here's the end. So here are the sample sizes, right? So remember what I said, we typically gather data based on a sample, and then we infer from that sample to the larger population. And here's the population we're going for, basically. So this National Survey on Drug Use and Health typically covers people ages 12 and older. Okay, so if you're looking for people younger than that, this may not be the data set for you. If you're looking for school-based data in grades 8, 10, and 12, then this may be the Monitoring the Future data set, maybe the one for you, and so on and so forth. The other thing that I want to point out is because, we're in Utah, our center is housed in Utah, and this particular data set is the Student Health and Risk and Protective Factor Survey, or we call the SHARP survey. It's sponsored by the Division of Substance Abuse and Mental Health in Utah. It's a school-based survey that's offered odd years, so it'll be offered again in 2019. It generally has about 50,000 students in its sample, and these are the grades and so forth. So for the example, what I'm trying to point out here is if I'm in Utah and I really want to drill down into school-based data, this may be a great survey for me to look at. But also, if you're in another state, there's likely a state equivalent that you have or worked with other states before that has something similar. It may not be called, the SHARP, it may be called something different, but work with your various agencies in the state that you're in to see if you already have access to data that can maybe help you drill down more specifically to what you're trying to look at. Okay, so let's get back to our example. It turns out that the question I asked, the data set that I'm gonna want to look at is the National Survey on Drug Use and Health. I already know this because I've looked at some of these data sets before, so I have some pre-knowledge on this, but that's going to help me answer my question. And as you become more familiar with these data sets, you'll be able to know, okay, which data set do I really want to go for? Which one's going to make the most sense for me to answer my question? Okay, so how do I get the data? What does that look like? Well, in the previous slide, I showed you what data set I'm going to go to. And I'm going to bring that up again, just in a smaller version. Here's my table, kind of my cheat sheet, if you will. Here's the data set that I'm going to use, and then I'm going to go to the web. The great thing about the technology is it makes more things accessible than it ever has been before, and we can get a lot of good information. We maybe have to sift through some information we don't want, but by and large, we can gather stuff we do. Well, it turns out that the Substance Abuse and Mental Health Services Administration has a great website, and they call it the Substance Abuse and Mental Health Data Archive. And it turns out if you Google this, it'll take you, it may not take you to here first, but this is a site that you kind of want to land on. And it talks about all the data sets that you have access to, publicly available data sets. And so if you look across this table, if you look at the SAMHSA, you can usually access most of their data sets from one landing page or from one site. The other thing I want to point out is that once you target your data set and you find the years that you want and so forth, that there's also opportunities on some of the newer platforms like this platform is to not only get access to the data, which is the data tab, which I'm pointing over here, but also to analyze. They may have analyze tabs, and what that may allow you to do, and in this case it does, is do some basic analysis where you don't even have to download data. You can actually do it on their website if you're looking at frequency counts or you're looking at crosstabs. So some of the questions you may want to ask of your data, you may be able to do directly from the website without having to get any more into it, but I'm going to show you that process anyway, than that. Okay, so that's really cool. The thing is, it'll depend on the data site that you're at, so not all data sites will have that technology, or some may be a little more clunky than others, but check it out, because it may be a way to save yourself time. But for me, since I like to analyze data, you know, I like to do research and so forth, I actually like to grab the data off the internet, pull it down, and then get it on my local computer, because that actually helps me manipulate it more in terms of answer the question that I want to answer. So it turns out from this data set, from the data set here, I went here and I downloaded an Excel file. And one of the options that was available to me was to download Excel. So one of my goals in terms of data analysis is, regardless of the options that it's available to me, I always want to try to get it into a program or a software program that I'm familiar with. So I'm pretty familiar with Excel. Many people have access to Excel. If you're not familiar with Excel, I would encourage you to become more familiar with Excel if you want to manipulate and analyze data and so forth. It's really helpful. So when I downloaded and opened the file, it ends, I know this is a little hard to see because it's a little small, but it ends up looking something like this, which is maybe seem a little messy at first, and it does. And it actually has all 50 states across the board, but I'm not really interested in all 50 states, in part because my question, remember, go back to our question, I'm more interested in region 8, so that's 6 states. So what I did is I also used Excel, and then I manipulated or changed the data so that it made more sense to me, and I created a table. So I kind of got rid of things I didn't want, and I created a table, and then I sorted. This is the actual table I created, and then basically here I have 6 states. I included the total US population, and it helped me answer my question, okay? The other thing I did in Excel really quickly was I created a couple graphs. And the cool thing about Excel is that you can easily create, with a few clicks of the mouse, go from your table to graphs. And there's one function in Excel called recommended charts or recommended graphs will actually give you examples, and it'll help you basically determine what is the best way to kind of look at some of these data and to kind of lessen the time where you have to spend playing around with that. Okay, so to go over these steps again, I used my table, then I went to the web, I just did a Google search, went to the web, found the data that I wanted, I downloaded it into a format that made sense for me, and then I kind of manipulated it in ways that made sense for me that allows me to answer my question. And that's where I'm headed all the time, is being able to answer my question. Okay, so step 2. So basically I've got through 2 steps of the 3-step data plan. So let's go back to our data plan and kind of recap. So what is my question? Here's my question, we went over that. Where do I get the data? I ended up using the National Survey on Drug Use and Health. I knew that would help me answer the question I wanted to answer. And then the third question is, how do I analyze the data, right? What does that look like? Well, I already showed you kind of some analysis that I did. Basically, I just got it into a table, and I found some of the outcomes that I wanted in terms of what does the prevalence look like of alcohol use with youth. But the other things that I want you to consider in terms of how do I analyze my data, and perhaps even more importantly, is who is my audience? Who is the audience that I want to present this data to? So if I'm asking a question, who are the people that are going to help to get it? They're going to work with me to answer this question. And perhaps even more importantly than that, how do I want to display the data, right? How am I going to display it in a way that makes sense to others? And it goes back to the question that I asked and actually answers that question. This is another common step I found where people sometimes get stopped. And in part because there's so many ways to display data that it may become a little overwhelming. But I really want you to think about who is my audience. So let's play with that just for a little bit. So here's a sheet I have, and here's some options for displaying my data. So you can see that I could display my data in a bar graph. I could display my data with another bar graph. This is a horizontal graph. This is a vertical graph. I can display my data in 3D, right? This is a 3D bar graph. I can display my data in a line graph. I can display my data in a pie chart. I can display my data in an area chart. I can display my data, this is called a scatter plot. I can display my data. This is called a tree graph. I can display my data. This is called a sunburst or a donut, and et cetera, et cetera, et cetera. Well, I want to point out there that all these data, this is the same data set across these 9 different graphs. Okay, so exactly the same data. The only changes I made, and I did this in Excel, and I got to each of these graphs with basically 2 or 3 clicks of a mouse, because it's pretty straightforward in Excel. And all the differences, it just displays how the data are presented, but it's all the same data. Okay, well, the question I'm getting to is some of these will be more clear to your audience than others. Okay, and my advice in terms of, and this is why I say where sometimes people get overwhelmed, is because they're not sure how to display the data, myself included. And so having spent some time with this, my advice to you is to keep it as simple as possible. Keep it simple, and keep it simple by going back and answering the question that you're trying to answer, and making sure you're doing that with your data and not using too much clutter in your graphs, okay? So let me give you that example even more specifically. So which one did I choose? I actually choose the first one. And I'm a big fan of the bar graphs, okay? So this is a bar graph, basically. It's a horizontal bar graph, and people typically tend to read graphs from left to right and from top to bottom. And so that's kind of how I set this up. So this is, remember our question is, what's the prevalence of alcohol use in the past 30 days? Well, in the past 30 days of alcohol use, you can see the different states in region 8. I also included the total of the US. You can also see, here's our 12 through 17 estimate. And remember our question I just had in 12 through 17? And I didn't have in 18 through 25. Well, it turned out when I was manipulating the data in Excel, that with one more click, I could actually get the 18 through 25 estimate. So it didn't really take me much effort to get more data. And kind of to think about this from a prevention perspective, what this helps me do is contrast the 12 through 17 estimate, which is this lighter gray bar here, with this darker blue bar, which is the 18 through 25 estimate. So if we look at these states, we can see that the 12 through 17 estimate, or the percentage, right, and here are the percentages, here's 10% around here, right? If we go to these, this is 70% around here. We can see that the percentages vastly change depending on the age range that you're looking at. So if we think about this from a prevention perspective, we may consider, well, working with youth younger, right, may be really important to trying to decrease their substance use, or this particular one, their alcohol use later on. And what I'm trying to show you here is the contrast between those two, okay, in terms of answering my question, even though I'm giving you a little more data than what my initial question suggested. The other thing I did here is I've also manipulated the colors. And I do this specifically because the gray color schemes and the blue color schemes are pretty easy to see. And I don't get overwhelmed with the colors and try to make things too fancy and too many colors. And what I said before is I like to really keep things simple, because between a gray and a blue, you can actually see the contrast pretty clearly. And the other thing we know is from specific studies of colors, we know that people tend to be drawn to darker colors first. So the blue here, people tend to be drawn to first. And so what I'm trying to highlight here is usually what the colors or the bars that I'll put in blue are things that I want people to notice first on my graphs. And it really tends to also then contrast with the gray color scheme here, so you can see the differences between those. Okay, but what I'm trying to show you here is to keep it simple, keep the graph simple, not to get it too muddy. I want people to be spending time on answering the question and not all the details that I have in the graph. And let me make this even more clear by saying, here's another graph of exactly the same data, but I added more details. So in this graph, I included labels for the axis. I put in states. I put in percentages, even though these things are redundant. You already know that there's states here, so why do I need to put in states? Why do I need to put in percentages? You already know that these are percentages. Why do I need to put in lines in my graph? I also put in, these are called data labels here, so you can actually see what the data look like. Sometimes you may want to include those. Personally, I think unless you have a specific reason for doing that, it just makes it more clutter. So if we put these two graphs side by side, right, and I know it's a little harder to see, but because they're smaller, but what I really want you to pay attention to is the details in the graph. This is the first graph I showed you that's cleaner. This is the second graph that shows you exactly the same information, but it's a little more cluttered. But you can see, I don't necessarily need to have the states in here because you already know what the states are, so it's redundant. Even though I can put it in there, it doesn't mean that I have to. As again, I don't need to have the percentages in there because you can tell that these are percentages by the percentage sign. I got rid of these bars, these horizontal bars here in the graph, inside the graph. It just makes it cleaner. And I actually got rid of the data labels as well. Again, you may decide to include those or not, but what I'm trying to show you here is big take-home message here is reduce the clutter in your graphs, answer the question you want to answer, and I'd rather have people spend time with my graphs answering the question that they want to answer than get caught up in not understanding the graph because there's too much clutter involved. Okay? Okay, so we answered our three-step data plan, right? What is the question? How do we access the data? And then how do we display it? So the next question that I asked at the beginning of the webinar, what is the percentages, which is kind of an outcome question, so let's take a different one. What are the percentages of youth completing substance use treatment? Well, again, we need to break that question down a bit. So who are the youth? So in this case, I'm gonna also think about what are the ages I wanna look at, 12 through 17. I'm also going to complicate it a little bit more by also considering what about race and ethnicity. So I want to know more, a little more data, or a little more information from the data. And anytime you start complicating it or sticking in more characteristics of the data, your analysis will become a little more complicated. So just to make that clear, okay? The other thing is, where are the youth at? Are they national or state-based estimates? Well, it turns out I want to look at kind of national-based estimates to answer this question. You could look at state-based. It just depends on what your question is. Also, what's the type of treatment, right? So we talk about substance use treatment. Well, I know this data pretty well, and I know that outpatient treatment, by and large, is the most popular type of substance use treatment there is. So I'm going to look at outpatient treatment because I want to have the largest sample that I can kind of look at, okay? So I kind of broke down my question, looked at some of the characteristics of things I want to do, and then I'm going to go back to my three-step data plan. First question. What is my question? So my question is, what are the percentages of youth ages 12 through 17, including race and ethnicity, completing outpatient substance use treatment in the US, which is an outcome question. Got that. Second question is, where do I go and get the data? Well, I already gave you kind of my cheat sheet, my table, so you have access to that already, and you can see that. So we'll talk about where I'm going to get that in a sec. And it turns out that the data that I want to look at specifically is the treatment episode data set or discharge data also from SAMHSA, okay? Which captures year by year what discharge data from substance use treatment looks like across the nation for both youth and adults. Okay, got that. And then the third question becomes, well, how do I want to analyze the data? Well, again, we want to consider who's my audience, how do I display it? And we've already talked about, from Jason's perspective at least, my go-to is kind of the simple bar chart. So I already have an idea of how I'm going to do that as well. Okay, but now let's talk about how I'm actually going to go and do that. Okay, so again, get the data. I'm going to go back to my larger chart. And this time I'm going to go to the treatment episode data set, discharge. I'm familiar with some of these data sets, so I kind of knew some of that beforehand. I'm going to go to the web, do a Google search. It's going to take me back to the same place I was before. So if you tend to come here a lot, you may want to bookmark that page. It's accessible to you. It's free to you. Use it. Again, if your question is in such, if your question makes sense that you could analyze this from this data portal using the Analyze tab, then you may be able to do that without even having to download any data or access any data on your own, if that makes it easier for you and so forth. Well, it turns out when I go to this data set, there's some different download options. And one of the and some of the download options is they're not so much in Excel anymore, but they may be in like a CSV file or a comma space file and so forth. Or they may be in specific statistical files like SAS or SPSS. And if you're not sure what those are, that's okay. But basically, again, what I said before is I want to be able to access the data in a way that makes sense for me. Well, it turns out that one of the ways that the data is accessible from this data set is what's called an SPSS or SISCL program for the social sciences, which is a pretty common SISCL program. And I was able to download that. It turns out I have that on my computer and so forth. And the reason I did that is because it allows me to manipulate the data with more flexibility than what I could do online. And so I actually, because I was interested in looking at race and ethnicity and so forth, I could actually manipulate the data in different ways to give me that information, because the data set as it was constructed from the survey didn't allow me to directly access that. So I had to do a few more steps in order to access that. However, after I did that and using my statistical program, I then imported it back into Excel and essentially just created a table like I showed you before. And here's my table, the exact table that I did. And then what I did again is just created a bar graph, okay? So at this step, it's pretty much exactly the same from what I did before. The step that's different, which is a little more complicated, is this step, but it's because of the data set that I access. So that's one of the things that I want to make you aware of. The data sets that you access will have different steps involved, and the accessibility of the data may be in different formats, okay? So it may be in a statistical format, and maybe in an Excel format, but the goal here is to get it in the format that makes the most sense for you. Okay, so what did I do? I went back, if you would look at kind of question number 3, how did I display it? I went back to my straightforward kind of simple, what I call a simple bar chart, and treatment completion from ages 12 to 17. So what does treatment completion look like for ages 12 to 17? This is all outpatient data. Basically, it's completed or not completed. And this time, again, I have the labels here across the side and then the bottom, and then these are numbers. And this time I actually did include data labels here, percentages. And I did that because in answering this question, I wanted these percentages to stand out. I also manipulated the bars here in terms of the colors because I wanted your eyes to be drawn to the darker blue color first, in part because that's what I wanted you to notice first. And what I wanted you to notice is that actually most youth in publicly funded substance abuse treatment do not complete treatment. Okay, so if we look at white youth, for example, 58% of youth, and this is from 2015 data, and this data doesn't change too much, more than half of youth do not complete treatment. For Hispanic youth, a slightly larger percentage do not complete treatment. African American youth, American Indian, Asian American, and so forth. This sample represents about 60,000 youth, and if we take all these together and kind of add them up and just put them in one bar graph, it would be about 61% of the youth who enter publicly funded substance use treatment actually don't complete it on an annual basis, okay? So does that answer our question? Yeah. Does it mean we have work to do from a treatment perspective? Absolutely. But what it gets at is it helps us answer that question and not make guesses about it, but informs us about what that means in terms of the broader context of treatment completion, which is really an outcome question. Okay. So hopefully you got the sense there that I displayed that. Hopefully I displayed that pretty clearly. I was able to see, and then I answered the question. Okay, so that's kind of what I wanted to present in terms of the 3-step data plan. But however, but before before we wrap things up, because we do have a few more minutes, I also want to display some other ways, or I also wanted to give you some other ideas for how to display data and some other places to access data. You know, you may hear about data visualization or viz, or data viz as it's commonly referred to. You may see things out on the internet all the time. For example, really cool websites where you may be able to access data. This is called the Opportunity Atlas. You can access this. This atlas looks at across the nation, what does household income look like, or low income or poverty? And you can see they use the colors here to represent data. So the darker colors represent lower household income, lighter colors represent higher household income. So the data visualization piece is really the idea is to present data visually, kind of like what we were doing with our bar graph, but even more clearly. And within a glance, being able to see what the data look like across a population, or whatever that population may be. So the population in this case is the US, but you could actually drill down to specific states and specific counties, okay? Another one that you have access to, this is called drug overuse, or drug overuse deaths in the United States. This actually uses kind of the blue and gray color scheme that I talked about before. So darker colors represent higher percentages of drug overdose deaths in the US. Lighter colors represent less. So you can see at a glance where areas are across the US that have more or less. And again, you can drill down to these specific states and specific counties if there are places that are interested in that help answer the question that you're trying to answer. The other cool thing that you can do on some of these websites is if you drill down, let's say to a specific state or specific county, it'll sometimes, depending on the website, it'll also sometimes allow you to then export that specific data into Excel or into something else, so then you can manipulate it in ways that make sense for whatever the question is that you're trying to answer. So take advantage of these things, take a look at them. If you see them come across your email, actually click on them and go to them and see what they have to offer, because they may help you really quickly answer some of the questions that you're interested in, okay? Another thing that I want to point out are infographics, and you're probably even more familiar with these. These infographics I've taken from the CDC or the Center for Disease Control. These specific ones are on tobacco use and e-cigarettes. And just a plug, I'm going to be doing another webinar in early June that's actually on vaping. And if you're interested in vaping, it's one of the common issues that a lot of youth, unfortunately, are engaged in at the moment. I've spoken to parents and educators and youth around this issue. So I'm going to be presenting a webinar on that so we can drill down into that more and understand some of the background information on that. That's coming up in early June. But these infographics are another way to display data. And this is a combination. Here's some graphic information as well as some text information to give folks ideas about whatever the issue is. In this case, it's e-cigarettes and vaping. But infographics are generally meant to be like kind of one page, one or two pages, some things that you can post that you can easily see the outcomes or the prevalence or whatever it is, whatever the question is that they're really trying to address here, okay? But a lot of these things are actually, you can access these things freely. A great source for some of these things are the CDC, along with a lot of other places. But if you're interested in some of these things, please, go searching out and find them. They come in nice PDFs, so you don't have to do, too much manipulation besides print them. And if you have a color printer, even better, because most of them are in color. But again, it's another way that I wanted to show you. It's a way to display data that can hopefully really quickly have people make sense of it. Okay, so my take-home points for you for this webinar is the first one is determine your question, whatever your question is. Start with your question, okay? And that's kind of based on, again, what I talked about before. And the more specific you can be in your question, the better, because that'll help you really drill down to the data that you want to find and you want to look at, okay? So more specific is better. And the other thing is, along with each of these take-home points, you may get frustrated because as the points progress here, as you go to the next point, which is find your data, you may have some difficulty finding it at first. You may not get to the first website that you want to, just from your Google search, but keep searching. Don't give up is what I'm trying to say. Be persistent. And that's, as researchers, that's kind of how we address these things. But I've already given you kind of a table or a cheat sheet. Also feel free to reach out to me if you can't access or find a certain data. Maybe I've heard of it or someone else has, or maybe it doesn't exist. Maybe you have to collect your own. But knowing that ahead of time can save you a lot of time in the long run. But find your data. Where is it at? Many times you can answer many of these questions with publicly accessible data sets that are readily available to you. They may seem a bit overwhelming at first, but break them down and make more sense out of them and make them work for you. And more specifically, make them answer the question that you want to answer, because that's what's going to be most relevant to you. And the third really big take-home message that I have for you, or take-home point, is analyze and present your data in ways that answers your question, but also really makes sense to your audience. So if you want to make a really complicated graph or some type of visualization because you can, that's great. But if it doesn't answer the question for your audience, then it may not be as helpful. If it has too much clutter, it may not be as helpful. So if you're the person who's looking at how do I present this data, ask some of your peers, ask some of your colleagues, what do you think this graph looks like? If I just gave you this graph, what do you think it's saying, right? And I do that all the time with folks and say, do you think this graph makes sense? Does it not make sense? What question do you think this graph is trying to answer, and so forth? And if they can't tell me real quickly, then I know I need to do a little more work. As we know that as we get frustrated with websites, if websites don't load very quickly, and I know there's data on this, how many seconds or milliseconds it takes if your website doesn't load, you're going to go to another website and whatever else. It's the same thing with us in processing information. If we can't process it really quickly, we're likely to lose interest and move on to something else. So you don't want your audience to lose interest. You want to answer the question you want to answer, but at the same time, you want to also make it clear for them so that they can answer it and not get caught up in the clutter of a graph. Okay, so that's kind of the webinar that I wanted to present. However, one of the things that came up as I was putting this together is one of the, and I realize this is kind of an overview webinar, and I didn't have time to drill down into the specifics, like such things as, okay, let's go to the website, let's find an Excel file, let's manipulate it and make a graph and so forth. I didn't have time to do that today. However, one of the things in our center, which we want to know, if you have interest in learning how to do more of the stuff that I've talked about today in terms of how to process the data, how to process epidemiological data, how to process sample data, we want to know if you have interest in us putting together a technical assistance virtual clinic in which we can do something over Zoom and basically run through examples. So ask a question, go to the web, download the website, manipulate it, and show you actually how to do that. If you have interest in doing that, then please email us at mountainplains._pttc pttc@utah.edu. In the subject line, put data TA or data technical assistance. And in the body of your email, make sure to include your contact name and email address so we know who you are. And what we're going to do is we're going to do a quick survey to see how many people we have interested in that. And if you do, if we have enough people interested, we'll contact you and we'll set something up for in order to put some type of technical assistance virtual clinic together so we can actually drill down into more specifically how to get into the data and what does that look like, in an effort to help you actually use data that's accessible and that's available to you, and to answer some of the questions that we may not have time to get into today. Okay, so please do that if you're so interested. The other thing that I want to plug for in a few weeks, we have our next webinar, and the next webinar in our series is effectively using technology for school-based prevention. A colleague of mine, Dr. Erin Fisher, will be presenting that. That'll be on Tuesday. I think it's 2 weeks from today. It is Tuesday, April 30th. So if you're interested in that, please register for that, and you can get you. Basically, I look forward to watching that with you. And I also want to thank you. And then we do have a little bit of time left, and I'm going to ask Shannon to help me to see if we have questions that I can answer in the amount of time that we have left today.
All right, thank you, Jason. We did have a question if you had a favorite infographic program. I did respond with Pictochart,
Yeah.
but I was wondering if you had any other suggestions.
You know, I think that's from Kim. I don't have a favorite one per se. My favorite one is whatever works for me the best. And Pictograph's a great one. You know, I would say, Kim and others who are out there that are interested, find one that works for you and use that one. So the thing about it is there's so many programs out there that, and we're all a little bit different in how we engage programs, like the human factors aspect of it. So find one that works for you, and also, you know, find one that has a lot of good examples so that you don't necessarily have to reinvent the wheel every time. Because when I'm learning how to do things, and we know there's a learning curve, especially with different programs, ones that I could easily Google and find examples for are ones that are really helpful to me, and also ones that other people use, so that if I am using it and I'm sharing my information with other consumers, you know, other groups, that they can easily access the information. So for what I'm getting at is it'll work on their platforms. They won't have any problem, you know, opening up the data and so on and so forth and accessing it. So it really depends, Kim. I would say ask you know, this is a good question to ask others and see what people are using out there. But again, yeah, Pictochart's a good one, but there's other ones out there. It just kind of depends on what works best for you.
Thanks, Jason. I'm going to leave this open for a moment to see if anybody else wants to ask some questions in the chat feature.
So if there aren't any questions, that's okay too. But I do, like I said before, if you have interest in this topic, please email us and let us know. And if you're interested in joining a TA virtual clinic, we'll try to set that up. Because the other thing is, what we learn from these clinics is it's not only just about one of us providing answers, but a lot of you have great information out there. And that's a way we can actually harness kind of the power of the group and to get a collaborative kind of learning experience.
Well, Jason, I haven't, oh, actually we do have a question.
Yes.
So what about testing a hypothesis as correlations?
Yeah, so I see Isabel wrote that. So we didn't get into, in this webinar, we didn't get into hypothesis testing. You can absolutely, test hypothesis as correlation based. There's other ways to test them as well, of course, which is more of kind of a statistical conversation in terms of posing a hypothesis or perhaps a question and then testing it statistically. Those are things you can do within the context of the data that we were looking at. But it's a little more advanced than what I was talking about today. Kind of what I was talking about today was just kind of presenting some of the information. But what I would say, Isabel, is that something that we could, going to those next steps, is that something that we could actually talk about within the context of a TA training clinic and so forth. As people have specific questions and want to see, am I able to test these statistically or not, and what does that look like?
Thank you, Jason. Okay, so I'm actually not seeing any more.
That's okay.
Questions. So I do have a question. I'm sorry. So.
Oh, yeah, so Mackenzie's asking me, is there a way to run a regression in Excel? There is actually, yes. So Excel has an add-on that with most common, so if you get Excel on your computer, there is an add-on feature that is an analysis, it's called an analysis function or feature, and then it'll put another tab. And you can run it, you can run correlations, you can run t-tests, you can run regressions. My experience is it's a little more clunky. Doing it in Excel, you can do it, but if it gets more complicated than that, then what I usually suggest is to use another kind of specific stats program like SPSS or something else to run some of those statistics, because you just have more flexibility and more options. But that is a great question. But that is also something that we could talk about within the context of a more in-depth TA and think about, what are some of the pros and what are some of the limitations. Mackenzie, what I usually use Excel for is to manipulate the data to get it into the ways that I want. And it's usually a good presentations tool. I don't use it as much for analysis, although I know you can, and I know a lot of people do, but I usually go to a more specific stats program for that.
Okay, perfect. Well, since we have the post-survey link up, I'm just going to tell you a little bit more about that. So first off, thank you, Jason. This was a great webinar. Thank you so much. And thank you to all of you who attended our webinar today. For those of you that have a QR code app, you may scan the QR code or you may click the link in the chat box. You'll be provided with a post-evaluation along with an option to complete a 30-day follow-up survey. So thank you again for attending today's webinar. And then Jason, do you mind going to the next slide?
Not at all.
So we recently put this together. This is just a quick reference on where you would find our on-demand webinars. So if you didn't have an opportunity to watch our previous webinars, they are posted and they're available on demand. So you just go to our website. It's pttcnetwork.org/Mountain Plains. And then you'll see the 3 bars that are circled next to the left of the Mountain Plains PTTC navigation. If you click that, you'll see the gray drop-down box, and then you can click on on-demand webinars, and you'll see our slides are downloaded and available. You can watch the recording. And then there's also at the bottom of our website, you'll see a products page, and they're also housed there. So we just wanted to let you know or show you where you can access our on-demand for those of you who missed it. And then we'll have our future webinars recorded there as well if you want to go back and view them again. So thank you again, everyone, for attending the webinar today. Thank you, Dr. Jason Bro-Sanchez, and I'll just turn the time back over to you.
Sure. Thank you, Shannon. Thanks, everybody, for taking some time out of your day. I hope this has been useful. If you have specific questions, feel free to reach out to me specifically. My email is in one of the slides, and also reach out to us more generally if you're interested in our TA, technical assistance clinic around this topic. So have a great day, great rest of your day. Take care of yourselves.